and their babies, in terms of women kind of community and statutory services linking together and provide that kind of support. So I'm sure there'll be some questions around that we might come back up and kind of pick your brain on that a little bit further, Justin. But moving on from Justin, so our next speaker up is Julieann. Julieann is the Infant Mental Health Coordinator with Youngballymun. And Julieann is going to talk about the issue of practitioner support and capacity building and its importance in nurturing parent and child relationships. And maybe just to kind of mention, just for people who aren't, I'm sure we've got people kind of logged in from outside of Ballymun, but as a project, Youngballymun, it kind of commenced in 2007, and it's now part of the National Area-Based Childhood Programme, which focuses on improving wellbeing and learning outcomes for children. The services of Youngballymun are really aimed at developing the capacity of parents and practitioners across children, family and community environment, and focus around kind of health, early years, primary education and community and other sectors. So a massive big brief there, Julieann, but I know you're going to chat to us more about your involvement with the Infant Parent Support Project.
I'm unmuted now. Thanks very much, Laura. It's great to be part of this discussion because, as you say, you know, Youngballymun really do feel passionate about working collaboratively with all the other agencies, and particularly in thinking about infant mental health. So this is great to be part of this. I just want to say, just in hearing Vera and Mary, it's lovely to kind of hear in detail about what you know, you're providing, and it really does fit. Back in 2012, Youngballymun had what was then really a cutting edge program. It was called the PCPS program, the Parent Child Psychological Support Program, and it worked with parents invited from the time the baby was born till they were 18 months, and it worked in collaboration with the HSE. And so speech and language therapists, public health nurses, psychologists were all working together, which was really fantastic, and looking to support parents in speech and child development. Even attachment was assessed, and they got support around that if issues were identified. And Vera and her team had noticed that their more vulnerable clients weren't engaging in the PCPS. So Vera joined Youngballymun team for a day and a half, and she was supported in that work to learn more about infant mental health. So it was really a fantastic example of practitioner support and capacity building, because then she was able to go back to her own team and share that information and engage with the parents in a new way that Justin just talked there about, kind of that therapeutic alliance. And that's really what we aim to establish with the parents that we work with. So just to move on, maybe just to talk about how important it is working with these parents at this very early stage. First of all, before I move on to that kind of idea of the importance of supervision space and further learning. So, I mean, I suppose we all know that pregnancy, delivery and the first months and years are really quite tough times at the best of times. And then when you add in vulnerability and difficult circumstances, it can be so much harder. So what we're looking for from our parents, I'm just looking at the time so I don't go over, is at a very basic level, we're looking for our mothers to feed their babies, to hold their babies, and to clean up their babies' messes. But it's far more than that. So in terms of feeding the baby, so what goes in when a baby is fed, the baby is looking at the mother's face, and the mother's face mightn't be very comforting for the baby at that particular point. So they might get a very still face or a harsh face. So what goes in with the food then? It might be some fear or some anxiety, or there might be some organic feeling for the baby. There might be something wrong with the baby that makes feeding hard. So then we know this feeding relationship can become difficult. Or holding a baby. A mother might not be able to hold a baby physically for whatever, maybe they weren't held themselves, but also holding the baby in mind. might be much harder to think about what does this baby need, or put the baby first. And we know that that can be difficult in lots of different circumstances. We're talking about maybe if it doesn't happen in what they call a good enough way, like if there might be possibly postnatal depression might influence it, or substance misuse, bereavement, if a partner is taking over. All of these things we see as kind of ghosts in the nursery, what's coming on, what's happening unconsciously for maybe a mother. Likewise, cleaning up the mess. It's not only a mess of the pee and the poo and the puke, but it could be kind of the psychic mess, the screaming of the baby, or the distress. And it might be hard for a parent, for whatever reason, to help that baby regulate. And the reason I'm mentioning all of these things is that there's also a parallel process for the people that we work with. The people that work with these families, should I say, that sometimes it's hard for us as practitioners to hold these families in mind. And sometimes it's hard for us, you know, when we talk about feeding, sometimes if we don't have a space to really think about and understand the families, we might overfeed them. We might come in with too much information, or what we're telling them might be imbued with some sort of judgment. Likewise, you know, holding them in mind might be difficult, particularly if they're very hard cases. They might drop out of our heads because it's actually too hard to think about them. Or likewise, cleaning up the mess. The thinking becomes really fraught. We might have a really busy caseload, or we might have things going on in our own lives that make it difficult. So in Youngballymun, we want to help practitioners help the mothers themselves, and that can best happen by supporting the practitioners and giving them a space. So there's various things we offer in Youngballymun. For a start, we offer training around infant mental health. So we have kind of, it ranges from sort of 2-hour taster sessions around infant mental health to a 2-day masterclass, which goes into much more detail. And the masterclasses, the topics covered are around attachment, around early brain development, for example, and what impacts the baby's brain development, and the importance of relationships, and also there's a lot of time spent on self-awareness of what do we bring to the work, and because doing this kind of work can trigger our own unconscious pasts, and that might make it more difficult then for us to see what's going on for the family and for the baby. And we emphasize keeping the baby at the core, so that we always want to see what's happening with the baby and within the relationship. So that's the detail of the 2-day training. And from there, if people are really interested in continuing to think in an infant mental health way, they could be invited. We have a network meeting, which is a meeting of different practitioners across Ballymun, who join together. So it's across different services, early providers, public health nurse, social work, psychology, and the more richer the disciplinary mix, the better. And it's an opportunity to share stories about the work, but it's guided by a particular topic, always with the baby at the fore. So it might be a topic in relation to feeding, or it might be in relation to sleep difficulties, or it might be in relation to you know, parental relationships and the impact of that on the baby. And everyone, papers circulated, and people take responsibility to read it and contribute then at the network meeting. And they happen once a month for an hour and a half to 2 hours. So we support people to attend networks, or if they have attended the masterclass and are interested, if they're not from outside the Ballymun region, we also support them to set up their own networks. And we have a whole kind of thing we follow in terms of supporting them to do that, and it's carefully thought out. So that capacity building amongst the networks. Also from there, we also offer reflective supervision. So we offer reflective supervision across different disciplines, speech and language therapy, psychology, early years providers, and you know, we'd like to just, and within Youngballymun, the staff themselves access reflective supervision. Also Vera, different agencies avail of reflective supervision that we have to offer. And that space really offers the practitioner an opportunity to think of what might be going on for this family. So yeah, it's really core to the development of the capacity to work with babies, because it gives a space to think about, okay, we might, like those mothers, the reason I mentioned feeding and holding and cleaning up the mess, it's the same in reflective supervision, that we come to it, that we as reflective supervisors give that core value that whoever is sitting opposite us isn't going to be judged in any way, in the same way that we want the practitioner to work with the family and know that those mothers to pick up that feeling that actually I'm not going to be judged. If I don't know about something, it's okay to bring that. If I have kind of unthinkable anxieties about something, maybe I can mention that to this practitioner, and likewise we're there to help support them. I think really in reflective supervision, it's the experience the practitioner feels of having somebody really in there with them, that they bring the case and they have another head to think, okay, what really is going on in this case? And that they have permission to say, you know, I'm really struggling with this, or I feel like I'm doing a bad job, or I feel like I haven't done this right. It's a safe space and nobody is being judged, and it's met with compassion, and it's met with another thinking head to go, well, what might be going on here? So let's give you space to think about you as a person, or let's think about what might be going on for the baby in this. And what is also brought up in this space is thinking, what was the feeling, and could that feeling that you had in the room be a hint to what either the mother was feeling or what the baby was feeling? So it really offers kind of the practitioner to step back and think, okay, there might be a new way. And when we have space to think about that, then we have the opportunity to think, what can I do next, and what can I do that's right? And we want to model that model so that when the practitioners going in there to the families do the same with their families. They meet whatever is coming to them with compassion and without judgment. And that's what reflective supervision offers. Also, it promotes kind of waiting and not acting, just waiting and thinking about what might be going on without having the right answer all the time, just that wondering about things. And that's the way we really want families, practitioners, to work with our families. I'm afraid now I'm going over with time. So yeah, it's just around attention, sensitivity, and responding to mothers. I suppose when we're tired and overstressed and have a maybe caseload too full of difficult cases, it's really hard for us to manage, and that's what reflective supervision holds and contains for practitioners. Yeah, it's just about taking a step back and bringing compassion back to the work. So I suppose I'll end with that because I'm very conscious of the time. Yeah, I think I'll end with that. There's more I could say, and maybe I can answer more for the question and answers.
Yeah.